the, the two-sibling model of understanding personality theory in causation of squint. Presenting author myself, Dr. Sarbaraj Nag, co-author Dr. Sarbaraj. Now the background. The role of personality traits of children in the causation of the squint was first suggested by Dr. von Nudun and his colleagues. But until recently in 2007, when Dr. Sarbaraj threw light on his paper, nothing substantial was known. Von Nudun exemplified with a model of two siblings, a 8-year-old girl and her 6-year-old brother, both having same amplitude of hypermetropia, that is +5 diopter, but reacted differently when confronted with stress of excessive accommodative effort to see clearly. Dr. Roy hypothesized that the girl had a stable personality as she confronted stress of excessive accommodation and saw clear but squinted. But the boy had a neurotic trait of personality as he instinctively avoided stress and relaxed accommodation to remain orthophoric but saw blurred. In the foregoing presentation, we would present a similar kind of model sibling as that of von Nudun and testify whether von Nudun's Roy hypothesis, when considered conjointly, are proven to be true in our model. A 4-year-old child with her elder sister and mother came to IOPD with complaint of deviation of eye, which is alternating from 1 year of her age. The mother also told that the child's grandmother has deviation of her eye and she was worried if it is hereditary or not. She also informed that her elder daughter is quite reserved and touchy, but her youngest daughter is more talkative, thoughtful and lively. The mother also wanted her elder daughter to undergo ophthalmological checkup. On examination of the younger child, the visual acuity unaided 6/12 both eye. The rest of the anterior segment is within normal limit. Full cyclobagic refraction was given, shows that right eye -1.25 spherical 6.6, left eye -1.5 spherical 6.6, N6 both eye. On evaluation of the squint, alternating cover test with prism showed 45 prism diopter alternating divergence squint, which is near is equal to distance, which is corrected with spectacle. Primary deviation is equal to secondary deviation in all 9 gauges, AC by A ratio 3:1. Synaptopore reveals decreased binocular single vision. There is no diplopia, nystagmus noted. FDT of lateral rectors of both eyes come to be negative. There is no AV pattern, no disorderly vertical deviation noted. So our provisional diagnosis is refractive, accommodative, concomitant, alternating exotropia. On examination of the elder child, visual acuity 6/9 partial both eye. Rest of the anterior segment is normal. On refraction -1.5 spherical both eye 6.6. On uncovered test, there is no foria detected. Now, the two children from the same family, having same gender, same socioeconomic status, same family history, and almost same degree and type of refractive error, one having exotropia and other one orthotopic. The only difference between the two children is a difference in their personalities. So we decided to go for a personality test for both the children with JEPQ questionnaire, which is assessed by neuroticism and stable dimension. On examination, the younger child, who is more lively, scored less than 12, suggestive of a stable personality, but her elder child, who is more reserved, touchy, who scored more than 12, suggestive of neurotic trait of personality. Both the child were given full refractive correction and advised to come for a regular follow-up at 3-month interval. Outcome is the individual with a stable personality trait are more prone to develop squint, whereas those with a neurotic personality traits are prone to remain orthoptic. These are my literature review. They are asked to follow up every 3 to 6 months and further evaluation and management of their condition. Now, what is the clinical implication? The most accepted theory of causation of concomitant squint is Dondos accommodation theory. But here we saw Dondos accommodation theory cannot alone explain the causation of concomitant squint. Therefore, this presentation proved Dondos theory superimposed with Dr. Nudun Roy is what may future holds for us. Until then, a lot more research is necessary. Thank you.
Tell me, personality trait disorders is something to do with the intelligence. The more intelligent children tend to have esotropia. and less intelligent children tend to have exotropia. That's well known. That again is related to the control of the eye by the attention center in the parietal lobe. If the parietal lobe attention center is strong, they probably are likely to be more intelligent. So this term I had never heard of, refractive accommodative exotropia. I've heard of refractive accommodative esotropias, but never heard of exotropia. You don't get refractive and non-accommodative possible, but refractive and accommodative, you cannot have exotropia. You can only have esotropia. Something wrong in terminology, but anyway, that's up to you to decide.
Okay. And I think you have just seen one case, and it's difficult to conclude anything by just looking at one case. So you came across only one case like this.
Thank you, sir.
And you are thinking.
Ma'am, there is also a study by Dr. Sarbaraj Nag, which include 60 total patients, which showed the same kind of result, but more number of cases required to establish this type of causation.
Yes, it's better to be presented as a case series or a study. Thank you.